Hi everyone, welcome back to my channel. My name is Becky Sechere. I hope you're doing well, and if this is the first time you've come across my channel, please remember to like, subscribe and share. I'm a nurse in the UK and I've been here for several years, and I give tips and advice to overseas nurses, carers, senior carers, or anyone who is new to the UK for work purposes and does not really know how to go about things. So in today's video, I'm going to be talking about how to access healthcare when you arrive in the UK as a migrant, as a skilled worker, for that matter, a nurse, care assistant, senior carer, or a student, or for that matter, anyone actually who have arrived in the UK as a migrant, especially for work purposes. As you know, our health is very important, and if you travel to a country, you need to know how the healthcare system works. You need to be able to look after yourself. So, healthcare in the UK is completely different from healthcare as we know it in our home countries. I can only speak to you about my home country in Ghana. So in Ghana, when you're unwell, you can go to any hospital you wish to go to, private, government, or whatever hospital you want to. So far as you have the money, you pay for any treatment you require. Recently, I watched a YouTube video of a lady from Kenya, I believe, who was in the UK, left, came back, and she came and had issues with some medical condition and needed to have surgery, and she finds herself on a waiting list for only God knows how long to get that treatment. So she had to go back to her country in Kenya to have her surgery done. There are difficulties in the UK. I work in a healthcare system. I work as a nurse in the NHS, and I will tell you, it's one of the best service or healthcare providers in the world. However, there are a lot of difficulties with care in the NHS, especially with accessing simple healthcare. So I'm going to start as to how you can access healthcare when you arrive as a newcomer in the UK, especially those of you who have chronic illnesses, for example, high blood pressure, diabetes, asthma, any other healthcare condition that needs monitoring. And let me include sickle cell disease. I worked before as a specialist nurse for sickle cell, so I like to encourage you, if you have come as a student, you have come as a worker to the UK, and you have any chronic illness including sickle cell disease, please, for anyone who have arrived, the first thing to do is to look on Google in your locality, check which GP surgeries available in your area and register with a GP. All you need to do is, if you search and you find the general practice or GP surgery or practice which is close to you, find out how to register. Sometimes you can register online and they ask you to come in and present certain documentation. Others, you would have to go into the surgery, speak to the receptionist about how to register, and they will tell you what to do. Regardless of whether you have chronic illness or not, when you arrive in the UK and you're going to be living here for more than 6 months for work, for education, please, whether you are healthy or you are not, remember you need to register with a GP. If you do that, you will get what we call NHS number, which is unique to you. If you have to go to the hospital, the first question they ask is, what is your name, date of birth, NHS number. Even if you don't know your NHS number and you provide your date of birth and name and address, they would find your NHS number. Even if you move from wherever you are to another city, they will find your NHS number and you will get the care you require. It doesn't mean if you haven't registered, you don't have NHS number, you will not get care, but it is easier. It is recommended that you register with a GP and you get an NHS number. So let me go back. So if you have a medical condition already and you need monitoring, if you register with a GP, you need to let them know that you have this medical condition so that they can refer you to a specialist in a hospital. In the UK, if you become unwell, you cannot go to hospital straight away. The starting point is your GP surgery. So for example, if I'm registered with a GP, I'm having severe abdominal pain, I've taken something and I'm not getting better, and I need to see a doctor, I'll need to ring my GP surgery. I'll speak about my surgery. You have to ring by 8 o'clock in the morning. Sometimes you'll be on the phone you will ring for more than 30 times. You ring and it's busy, because most other people are trying to get through to make an appointment. So that can be very, very frustrating. As I said before, back home, you don't do that. You just go to the hospital, you get registered, you get seen. But in the UK, you start with your GP. So you ring. If you're lucky and you get through and there is an appointment, they make an appointment for you and then you can see a GP. Now, as you know, post-COVID, or because of the pandemic, we've all learned to work using telephone consultation. So the receptionists at the GP practices, I call them the gatekeepers to the GPs. They would ask you what is the thing, what is going on, and they'll be able to triage you to either a pharmacist, a nurse, or a GP at your surgery who would deal with your situation. So first of all, they might organize a telephone consultation with you, and then they see whether you need to be seen or not. If it is you might be lucky, you get an appointment on the day. If you're unlucky, you will not get an appointment on the day and you would have to ring again the next morning. So these are some of the difficulties and frustrations with the system, especially coming from a place where you can get whatever care you need if you have the money to pay. All right, so if you manage to register and you get to see a GP, you need to let them know whatever medical condition you have. If you have sickle cell disease, you would need to be referred to a consultant or a specialist in a hospital closer to you so that you will have your annual reviews. They would get all your basic, information, your baseline blood test and know where you are at, how often you have crisis and all those things, so that when you become unwell and you get admitted to hospital, they already have the baseline information about you. If you have blood pressure, asthma, or any other chronic conditions, some of them are managed by the GPs. So your GP surgery will manage your medication. They will give you your monthly prescription. Normally, if you get prescription, it's about £9.33 per month for a single prescription. If you get two on the same prescription, it's the same. However, there are other things you can do. You can buy what we call prescription prepayment certificate. So if you are someone who gets prescriptions more than one in a month, it can be a bit beneficial to look into getting prescription prepayment certificate where you pay a certain amount, 3 monthly, 6 monthly, or annually, and sometimes it can be a bit cheaper. So situations like that, yes, that is what happens. And now, if you're unwell and you get like a flu or cold, there are online services. You can ring 111 for health advice. You can go and see a pharmacist who can give you basic advice about certain things you can use to manage yourself. But things like severe abdominal pain, life-threatening situations, you call 999 or you go to the emergency department. So those are the things you need to bear in mind, and if you get pregnant and you're in the UK, you are new, you go to your GP surgery, you would tell them you're pregnant, you need to see a midwife. They will register you with a community midwife who will look after you. At some point, you get seen in the hospital and have your hospital appointment. So some of these are some of the ways you will look after yourself. You say that, oh, I'm very well, I don't need a doctor, but it is important to get yourself registered with a GP so that it is free. You do not pay for it, because when you're coming, let's say as a student, you pay health surcharge. If you're a nurse or carer, you are working. If you've been exempted, When you're working, you're going to be paying your national insurance, you're going to be paying taxes, and these extra monies we all pay every month, you know, covers the care we receive. So it's very important for you to, you know, register, look after yourself, look after your care. What do they do at GP services or GP practices? So they give you health advice, they give you prescriptions, they refer you to specialists if you need to see a specialist. What else? They do MOT or health checks for over 40s. And so some of us are walking about blood pressure, diabetes, and high cholesterol. We don't know about it. But if you're an over 40, if it's not been picked up and you do your over 40s health check, MOT, you may be identified as having one of those things. And then early prevention is better. So it's better to know, or rather than not to know. So it's important to do that. At the GP surgeries for females from the age of 24 and above, they do smear test. So they take samples from your cervix and they send it off to, you know, identify early signs of cervical cancer and things like that. So it's important for you to register and you don't miss out of things like that. All these health screening that is done in the UK. If you are 50 as a woman, you would be invited for breast screening. I've had mine done and I'm going to do a video specifically about that experience at some point. And it's important for you to attend all those things as well. How do the GPs or your doctor see you? These days, once again, there are video consultations. They do telephone consultations. Most GP surgeries now have online services. So you can request for your prescription online. If you need to have frequent prescriptions or monthly prescriptions, you can do the request online. You can request for appointment online, not on the same day, but maybe if you need an appointment to discuss something that has been going on in the next month or so, you can actually arrange for that. So familiarize yourself with your GP service and see what services they provide and make good use of them. And do not just stay and say, I'm well, I don't need to see a doctor. You know, like flu vaccinations, COVID vaccinations, if you get registered, if you're eligible, you get contacted to come and do it. And, you know, those are some of the things you need to do. Look after your health. So today it's all about looking after yourself. It's about giving information. Those of you who are not aware, those of you who have not yet registered for a GP, I think you just need to make sure you do that. It doesn't matter whether you register with a GP and you don't need to see your GP, that is fine, but it is better to do that rather than not to do that. Once again, as I said, the NHS, it is not 100%. Yes, you get the care, but there are times that you can have a lot of frustrations. There are people who are waiting for hysterectomy, people who are waiting for things like orthopedics sort of surgeries. Is like not life-threatening. If it's life-threatening, you would be sorted as soon as possible. But if it is something that can wait, then that one you're put on waiting list. Sometimes hospital appointments can be cancelled and can be very, very frustrating. My experience, so recently, I think 2 weeks ago, I just suddenly had these rashes all over me and I thought, what is going on? And it just started, you know, spreading and carrying on. And I thought, oh God. So I called my GP. Yes, I got the appointment. First of all, it was telephone, and then I've been asked to take pictures of the rashes and I'll send through, and I sent that through. They looked at it and they said, okay, we need to see you face to face. So a bit of time wasting. If I had just got that straight appointment to see someone, I'm seen, I'm examined, that's it. But now telephone, then send photos, and then after that come in, I get seen and I get given medication, and I was asked to do some blood tests, which I did. Now, another thing I found very frustrating was that I needed some medication, which is not a common medication in the UK. It's mostly used in the tropical regions, especially in Africa. And so this medication was prescribed by my doctor, GP from the community. And I looked everywhere in the community pharmacies and I did not find this medication. I visited about 5 different pharmacies and I didn't find the medication. So I went to the hospital and Could you believe they have this medication in the hospital pharmacy, but because the type of prescription I have was from my community, let's say GP, the hospital pharmacist said, yes, we have the drug, but we cannot issue the prescription to you because it is written on a GP prescription. So these are some of the bureaucracies and the difficulties you might face. These things happen in rare cases, but there are a lot of things that can be very frustrating. So what did I have to do, or what was I advised to do? I was told the best thing would be go to A&E and get a doctor to change the GP prescription onto a hospital prescription, and then we can issue that prescription to you. I was so frustrated anyway, and we all know that A&E, which is emergency department, is for life and death. But I had to go there and I had to register to booking to say what I needed. I'm taking a place for someone who is acutely ill, which ideally shouldn't be. And then after that, I was sent to another area where I had to go and wait. But I'll give, thanks to the receptionist. She looked at it and she said, oh, you don't really need to be waiting for this. I'll get a doctor to change the prescription onto a hospital prescription for you. So I waited for at least about 45 minutes to, let's say, almost just under an hour, and it got sorted. And then I now have to go back to the hospital pharmacy to submit my prescription. And now they tell me, oh, it's almost break. You have to wait for until 3 o'clock. This is about 1 o'clock. So, I spent almost about 4 hours of my day going between A to B to C and D, which sometimes can be very frustrating. I've met people who are waiting for all sorts of, appointments or things, and they're saying, oh, my appointment has been cancelled, it has been rescheduled. There are some places you don't even get the appointment, they tell you're on a waiting list. So some people get frustrated from those from abroad. Some actually go home, get leave, and then go and have their surgeries and things sorted. Just again, these are surgeries that are not life-threatening, things that can wait. But, these are some of the difficulties. It is better you know about them. So when you're going through, this is what it is like. Anyway, I hope this video has been helpful to you. Take care of yourselves. As I said, if you've arrived in the UK, you're going to be staying here for more than 6 months. You're going to be working in the UK. Do register with a GP. Find a GP in your locality. Register so at least you are on their books. If you have a medical condition, a chronic illness that needs looking after and monitoring, please, if you register, let them know so they can refer you to the appropriate specialist team to look after you. Anyway, look after yourselves, take care, and I'll see you soon. Bye-bye.